Well, thank you so much, everyone, for having a little listen in to our webinar tonight, which is all about women's health. I think it's such a topic that is very, very current and something that all us women can benefit from, and also just opening that discussion, I think, can be really, really powerful. They like we often talk about kind of women's health, and a lot of people, women in particular, like they say, 75 to 80% of healthcare decisions for the family are made by the women, but they still put their own health last. So I think, it's really important because as we all know, like we're all women on this call tonight as well, but hormones impact so much more than just the reproductive system. And we're going to kind of touch a little bit on that tonight. But also, diseases and conditions also present very differently in women than they do men. And I remember this massively from my days when I used to work in cardiovascular. And women were often missed when they were having angina attacks and heart attacks because it wasn't presenting in the way that men present with a heart attack. And so it was often getting missed. And I think it's really, really important for us to start to build that awareness and build that knowledge. We often kind of say that hormonal changes with women don't just impact us, they impact our whole environment and our family. So we need to invest in women's health, and I feel like we need to invest time, energy, money, all those sorts of things. We have about 30 known symptoms of hormonal changes, and there's so many more that I'm sure are unknown. And with women kind of undergoing huge transitions with very little support, it is improving, but it's hugely isolating as well. And there's actually a statistic out there that they say 1 in 10 women leave their jobs because of menopause symptoms and identity changes, which is so massive. You think of all the women out there. So really, tonight is about education. It's about empowerment. It's about putting women's well-being back at the center of the conversation. So that's what we're going to start with tonight. So I'm going to head straight over to our first practitioner, Danny. So Danny, I know that you are a women's health practitioner, and I remember speaking to Danny for the first time, and I loved how she explained the changes that women go through in menopause in a really, really lovely way. It gave me a completely different perspective as well. So firstly, before we kind of get into that, I'd love you to share with us what you do firstly, but then kind of help us understand the neurology behind hormones as well.
Sure. Okay. So I'm a menopause coach. So I support women going through that transition from the sort of the practical, as in kind of helping them to understand what's going on in their body, the sort of help that is out there, whether they choose to go down the HRT route or not, helping them prepare for their appointments with GPs, because, frustratingly, even though, as you said, Steph, menopause is out there now, we talk about it, it is frustratingly slow in actually trickling down to the people that need it, which is, us women. And unfortunately, very, very few GPs have the training or the understanding or the knowledge to be able to really understand what is going on for these women, specifically if they are younger than expected. There's that sort of, what's the word, that kind of wrong association that menopause is happens to older women, that it's a sign of aging, of getting older. Yes, sure it is, but it's quite normal for women 35, 36, around that sort of age, to be experiencing perimenopause symptoms. But if they go to the doctors, they'll be dismissed on the basis that they're too young. And that's got a whole other set of implications. So I kind of help support them with knowing what to discuss with their GPs, but also from the mindset perspective, because when we realize that we're going into that stage of life, there are a lot of things that are happening hormonally and neurologically, which can have a massive impact on things like our self-confidence. Imposter syndrome starts to speak up really, really loudly. We lose trust and lose confidence in our abilities. You quoted the 1 in 10 women leaving employment. That has a lot to do with it, because they suddenly feel that a job that they had reached quite a high level in and were considered by all and sundry to be very good at their job, they're suddenly forgetting people's names or forgetting to show up for meetings. and that can play havoc with a perimenopausal mindset. So being able to kind of support women in that as well, and be able to help them as well in order how to communicate with their families what's going on with them. You said again about that we kind of make the majority of the medical decisions as far as our family's concerned, but the domestic load falls on our shoulders. It doesn't matter if we have, if we're blessed to have a really supportive other half, the majority of the domestic load falls on our shoulders, as well as having a job, looking after the children, etc., etc. So that is a lot for a menopausal brain to handle, and that can impact massively on women's confidence. So that's how I support them.
Yeah, that's lovely. I mean, I remember you when you kind of, I can't even do it myself, but you had such an impact in the way that you kind of explained that change of menopause in life. Like explain that to, to whoever's listening as well. Like how do you see menopause?
So we know that menopause, or the menopause in itself, that's a bit of a collective term, because the actual menopause itself, which is the stopping of our periods, the stopping of the ovaries producing eggs, is actually one day. One day. It is a year, it's the day after it's been a year since your last period. Perimenopause is the period, excuse the pun, of time leading up to that. Postmenopause is after that one day. So, using the word menopause to kind of cover the whole spectrum, we know that the hormones are changing. We know that the hormones, estrogen, progesterone, testosterone, etc., are declining. But if you think of it from the point of view that your brain is the hardware and the hormones are the software, okay? So what that means is that the fact that the hormones are declining means that the brain has to learn how to function using with less hormones, using the energy that the body usually puts into producing an egg, preparing the body for pregnancy every month. Obviously, that doesn't happen once you get into menopause. So it's having to learn how to use that energy differently. And the fogginess we feel, the hormonal reactions, or the lack of hormones reactions that we experience, is all because the brain is basically going through an update. So it's really important to stress that even though we may feel different from how we did, we are not deficient. It's our brain is just learning to run on a different program, which I think is a really powerful way of looking at it and understanding it.
Absolutely. Like I love that. It's almost like it's that transition, isn't it? And it can be, although yes, it can be challenging. I suppose looking at it, I mean, there's a lot of kind of, oh God, wait until you hit menopause. There's a lot of kind of black cloud that sits above that word. So I think like when you kind of just look at it differently and see it as a transition, and actually we're not working the way we were, but it's a way to almost reinvent. It's it's quite exciting.
It can be exciting. It is an opportunity. There is a reason as well that so many um, female founders and female entrepreneurs tend to start their businesses as they're going through this menopause transition, because you get what did I read somewhere recently that estrogen is your people pleasing hormone. Estrogen is the hormone that kind of makes you got to just try and keep everybody happy. Whereas as that starts to decline, you start to think, actually, you know what? None of that. I'm done with the people pleasing. It's time to focus on me. And it can be very powerful. Obviously, in a from an evolutionary point of view, by the time women went through this transition, the children were older, they'd left the house. Now the disconnect rather, is we tend to be having our children potentially later in life. So you could be going through the perimenopause when you've got young children around, And even if you've got older children, so mine, for example, I've got twins of 23 and a younger one of 21, they're not going anywhere. They're coming back home, which I love. But with that comes all the angst and the worry of young adults trying to make their way in the workplace, or, matters of the heart and broken hearts, etc. And that's a challenge when you're perimenopausal, because you want to go to sleep and they want to talk at 11 o'clock at night. So it's it's managing those neurological changes, those neural shifts with how our lives are structured and set up now, which
Yeah.
can present a bit of a challenge, but it's not impossible. And actually, once you're more comfortable with what's going on, once you can understand what's going on, once you can explain to your family what's going on, that's the first step to actually getting the support that you need.
Yeah. Oh, I love that. It's so lovely hearing from you. So thank you so much for kicking us off tonight, because I think it's so true. And I remember you kind of saying beforehand about like the hormonal shifts and changes in women. They're almost kind of blending together when you've got, like you say, young children breastfeeding along with perimenopause coming up all at the same time, and it's just a whole
Yeah.
mash of everything. So yeah, thank you so much, Danny.
Pleasure.
We're going to move on to Adele as well, who's also another women's health practitioner. And it's interesting you kind of mentioned there just before, Danny, about dealing with children and their hearts and everything like that, and it kind of puts us back into being that young adult, And I think when we're growing up, we're often thinking about hormones as just being. Firstly, I'm talking about it with my children at the moment as they're kind of coming up to teenage years, about the body changes and into becoming an adult, and then moving on then to kind of fertility and periods. And I think there's almost like big sections of our lives as a woman that you kind of just, oh, I'm on to that next stage, but it's also so much more than that. So I'd love to kind of hear from you, Adele, and just to ask, how is women's health impacted and their brain function? Like, I know Danny mentioned it slightly, but just a little bit more on kind of how it can help, hormonal changes can affect women's mental health.
And I think, in my personal opinion, that this is one of the biggest failings of the current understanding of women's hormones, and the fact that women have largely been excluded from both medical and lifestyle research. And therefore, we have a very patriarchal model of how we view health and mental well-being. And I believe very strongly that had women been allowed to be involved in the development of medicine, we would have very different approach to how we manage mental health, particularly in women and with men, I believe as well. I'm a big fan of the work of Dr. Phyllis Bronson, who's really written about the impact of hormones on managing mental health. And, right back into the 50s, we can see high dosing progesterone being used to treat PMDD, for example, extreme PMT, which was the work of Dr. Katarina Dalton. And that work has just been continued through various really pioneering doctors or pharmacists that have taken this work on, but it's never really reached mainstream. And we have to stop viewing hormones as just being around our uterus or fertility or what we think menopause is. These hormones are multi-systemic. Practically every cell in your body has an estrogen, progesterone receptor on it. Testosterone, we can have a big conversation about, but we'll just focus on those two for this purposes of time here today. And if a cell has a receptor, it means it depends on that hormone to do its job properly. So when these hormone levels are fluctuating, as they do throughout the month, when we're regularly menstruating, we're not on contraception, we're in our 20s, we're in our 30s, we're ovulating, we have a surge of estrogen in the first phase, surge of progesterone in the second phase. These hormones act on different neurotransmitters. So estrogen in the first phase really sensitizes dopamine and serotonin. Great, but it also sensitizes something called glutamate and histamine, which can be very stimulating on the nervous system and not have a great impact on mood at all. Whereas progesterone acts on something called GABA, which is a bit like Valium for the nervous system. And this is the first hormone that goes in perimenopause. I would say I analyze a lot of hormone data, and I would say the first 10 years, Danielle spoke about this starting mid-30s to mid-40s. I don't see women needing estrogen. And yet we have an HRT model that is obsessed with putting estrogen in women's bodies. And I actually think this is quite harmful when women don't need it. Whereas progesterone is the hormone that declines. It's the one that's coming down. We're not ovulating as efficiently as we were. We're not meant to be. That's all meant to be happening. But alongside that, we start to see anxiety. We start to see overwhelm. We start to see poorer sleep quality. This is progesterone. This is the impact of progesterone. And yet we're not speaking about that. Progesterone is a mood stabilizer and nervous system regulator. And yet the only attention it gets medically is to protect your uterus, which is really important. But it's also massively important for growing your bones, protecting your breast house, supporting the myelin sheaths around your nerves. This is what we see in women. And women in early perimenopause don't recognize that it's the progesterone decline. We just start to think we're getting a bit irritable, or we're feeling a bit anxious and don't really know why. And women start saying, I've become anxious and I don't know why I'm anxious. I'm not an anxious person. I'm like, okay, what's happening with your hormones? And that to me should be the first question. When we're looking at a woman's emotional well-being, why are we not looking at our hormones? I know that's totally my bias, but that to me seems a really sensible question to ask.
I love that. And do you know what? It's funny because I've only ever heard really about estrogen. So you kind of throw in progesterone in the mix there. Obviously you hear about it, but like you say, when it comes to menopause and things, you just talks about kind of the estrogen side. Why do you think that hormone is so misunderstood? And when they do blood tests, what are they looking for when are they looking for an estrogen decline, or are they looking for progesterone as well?
Okay, so there's a couple of things here. First of all, blood tests I don't think are very helpful for estrogen and progesterone. Your hormones, your endocrine glands are pulsing all the time. And what you could test your progesterone and estrogen in the morning, and 5 minutes later they'll look completely different. Okay, it's a pointless blood test for lots of reasons. Okay, if women want to test their hormones, I suggest a urine test with something called Mirror, which is amazing. We see what's happening throughout the month in the exact levels. So around blood tests, it's not a helpful measure really for most cases. I've had the privilege of working with the international lead researchers on progesterone. I run my clinic with a specialist GP who I would say is the absolute lead here in the UK on progesterone dosing. Most women in our clinic are on progesterone and higher doses than you would perhaps get through the NHS. And we're seeing incredible results with what we're doing. But the reason I believe it doesn't make it down to frontline practice is probably going to be a bit controversial, but it's me. It's a natural molecule. You can't patent a natural molecule. Okay, body identical progesterone is made from soya and yam. There's no money in it. Okay, but to take what they did in the 50s was take a body identical progesterone molecule and went, wow, look at what this does. Let's manipulate that molecule in a lab and turn it into a gazillion-dollar business. So we get the synthetic progestins, which are not progesterone. They have a very different risk profile. They have very different side effects, and yet they get called progesterone. And so it's a very messy world for women who are already overwhelmed, exhausted, just need a solution to try and unpick this chaos. So it's a complex process, but body identical progesterone you can buy online. It's an incredible nervous system support, incredible mood stabilizer for many people. So I feel very passionate about raising awareness around progesterone. I've written an ebook on it because I do think it's a miracle molecule when we get it right.
I can see your passion there. And so if people are looking into this is very much for someone who's going through the change, would you say?
Yes, but also throughout the cycle. If someone has PCOS, they're not going to be regularly ovulating. They will be progesterone deficient, right? If someone is suffering with PMT, sore breasts, heavy bleeds, doesn't matter what age they are, that is progesterone deficiency in many cases. Okay, someone has endometriosis. We see incredible results in our clinic with vaginal progesterone. So there is so much scope at any age. There's an incredible book called Adrenaline Dominance by Dr. Michael Platt, and he talks about using progesterone cream on children, men, and women for things like IBS, ADHD, PMDD. It's fascinating work.
Oh, it's so lovely to hear your take as well. And this is what I love about these chats, because you can kind of get different perspectives. And I tell you what, you would probably have a really great chat with who we're going to talk to now, Jackie, because she's in pharmacology and she's our clinical health coach here. But I'm sure she would kind of have a lot of information around that as well. So thank you so much, Adele, for sharing that with us as well. Okay, so moving on to Jackie then. Jackie, obviously you coming from a clinical health coach perspective as well as all your background as well. Can you explain to us a little bit more how women's health affects them from a metabolic well-being and kind of energy perspective as well? Oh, Jackie, you're on mute.
There we go. Can you hear me?
You can, yes.
All right. So, yeah, I'm not really a hormone specialist in terms of reproductive hormone and estrogens, progesterones. I look more at sort of overview of the whole sink around it. And yeah, so basically for me, I think, women's health often is fragmented into sections: weight, hormones, metabolism, mood, sleep. But in fact, it's actually for me a whole syndrome. And I think that's kind of what both Danny and Adele were alluding to. The work that I do is much more at a metabolic level, at a cellular metabolic level, where I work with a concept that I have called the hungry bear, to work with patients to understand the whole picture of metabolic signaling and why it goes so wrong. And it obviously in this particular patient group where you've got, as you both alluded to, early onsets, 30s, things are changing, there's dysregulations. But it's actually the hypothalamus, which is what I call the hungry bear, that's in charge of all sorts of systems in our bodies. So the hypothalamus, basically, from the concepts that I use, basically, it's a very small part of the brain, but very powerful, and is really in control of hunger and satiety, your energy expenditure, your hormonal integration. So I tend to look at it much more, from a holistic sort of overview than pinpointing that sort of thing. It looks at, as I say, that hormonal integration, stress response, circadian rhythm. And basically, when all these systems go out of sync, what we start to see in a lot of women are dysregulated responses. So signals change, that you often speak to women, patients often say to me that their hunger just gets louder and louder and bigger, and I don't understand why. I exercise more, but I put on more belly fat, why? So that's the kind of work I do, is it's much more looking at the causes around dysregulation. What we find so interesting, I mean, you find people just not feeling full when they've eaten, when all these changes are happening, more and more craving, they lack energy. So what we really do is, from my work perspective, is I go back to what they eat. I'm not a nutritionist. I make that very clear. But what I do believe is that food is medicine, if you have an understanding of how it fits together. And when it's all going wrong, and as you say, women are coming to you at 30, like not understanding these changes, often what we look at is the role of insulin resistance, because that plays a huge role in why things go wrong. And I think sadly in this country, we don't test for insulin resistance. We shout and go on about glucose, but often patients are pre-diabetic, presenting with that pre-diabetic HbA1c profile, and they go, oh, you'll be fine for another 5 years, because it takes about 5 years before full diabetes kicks in. But if we're not managing the insulin resistance, that's actually where the issue is. And a lot of diseases, I mean, are linked to simply, and the new research has come out now in the last sort of 6 to 8 years around how insulin resistant is responsible. I mean, even things like losing hearing, the mechanism around inflammation. Patients will come to me and they'll say, oh, I've had a binge, I've been eating wheat, now my joints are swollen. And so, yeah, it's a really, really complex system. And basically what it is that the glucose in our body is incredibly damaging. And I've always said, in my models that I use with patients, is that you need to teach patients that, once they get control of that sugar that's like sandpaper in their blood. We start to get over the insulin resistance, we start to get regulation. And then another big thing that we look at in sort of building all the hormonal balance in women's health is looking at the impact of stress. So cortisol, we know, is something that pushes sugars into the blood. It's like you've got to run from the lion. You need energy for those muscles. And so women are often living in this sort of sympathetic nervous system state from the minute they wake up. Then they think, God, I must go to the gym. I've got to work out. And they go crazy and they go work out, doing far too much, driving up cortisol, driving up their blood sugars, driving up insulin resistance. And then, just everything's out of sync and getting worse and worse and worse. And then obviously, as you say, the woman carries the burden of the household often. And things like poor sleep. So circadian rhythms go crazy, and the hypothalamus is your master clock. It controls, every single cell in your body. And simply understanding kind of those things around, if I'm not getting enough sleep, what's also happening is that my gut is getting distracted. And the gut is only working for 10 hours of your day. So it needs the time to clean out and use all the bugs and, that sort of thing. Someone.
Yeah. Oh.
So yeah, it's about hormonal shifts that's not just related to hormone. I think our whole body regulation sort of is around that. And it's about, how do we manage the gut health? How do we get people into sleeping proper? I always try and use a section on sort of what I would call sleep hygiene and take it very seriously, not just for the weekdays, but the weekends as well. So yeah, I think I step back a lot and I look at the bigger picture and kind of bring all aspects together and try then. And what I do is I work on, trying to just make a person take a look at their journey. Why have we got there? What can we change? Because a lot of it is changeable. I think that's the most amazing thing with understanding the likes of insulin resistance and inflammation. You can change your body's outcomes within a week or two with just correct, eating and adjusting. So yeah, really, the other thing you got to remember is that insulin reacts very closely with your estrogens, your cortisols, your thyroid functions, all your reproductive hormones. So yeah, we've got to manage it as a whole. I think that's really important.
I think it's that, isn't it? It's part of the puzzle, and it just shows how much of a knock-on effect of just something being slightly out can then affect all the other systems as well. And it's and then that has a huge effect on how we think, feel, behave, everything.
Absolutely. And the way we turn to food, and then as you say, as the hormones do fall off, we kind of have binge eating, we never full, we need energy, and it sort of just self-perpetuates into this person who's just losing the plot.
Yeah.
And then kind of they go to doctors, as you say, and don't always understand the holistic issue of what the woman issues are about.
Yeah.
So yeah, as I say, mine is very generalistic. I stand back a lot and try and cover the whole picture of dysfunction, sort of from a hypothalamus metabolic point of view.
Yeah, no, I love that. I do have a question for you, because I did have someone message who couldn't be on live tonight, but they did actually want to ask a question. I think that you might be one of the best people to ask.
Not sure about that, but let's try it.
Or if anybody else wants to jump in as well. Yeah. So this person, she's been struggling for quite a long time with massive fatigue, and recently was found to have quite a low B12 after a blood test. She was put on supplements. Then she had a repeat blood test, but she was still on the B12 supplements, which they then said, all fine, in normal limits, happy, see you later, off you go. She's now obviously finished supplements. There's no kind of follow-up. There's no follow-up blood test. There's no long-term B12 supplements. And so she was just wondering whether, is this because of her going through menopause? And should she be taking more frequent blood tests or undergoing some kind of supplementation? Because her iron count's always been slightly under, but nothing has ever kind of been done. So long-term, any tips?
Well, I think the important thing is to ask questions around her nutrition and to say, I'm not a nutritionist in any way, but I need to understand, is she a vegan? Who not? So she does eat meat and
She's very, very, very sporty, and because I know her personally, she's very, very sporty, and she's eats very healthy as well, and a very varied diet.
right. And what age is she?
She's 41.
Right. So the first thing you need to do is just get a full blood profile to understand which component of the blood workup is also misaligned. And
Yeah.
absolutely, I mean, the readings when you're on these supplements will show up on the blood test and can be misleading.
Yeah.
So really important to get all the basic work right. But I do think once you also, what for me, because I sort of specialize a lot more in the gut health, with your microbiome, I do think you need to look at where and whether or not, if the gut is leaky in any way, if she's got a leaky gut syndrome,
Yeah.
she might not be getting absorption of the appropriate vitamins and stuff.
Yeah.
So I think it's very difficult to pinpoint it. I do believe in supplementation. There's also a lot of clinical conditions that could, be the problem. So we can't just randomly, say it's just that she's lacking in nutrition. You need to exclude that. But I think also what's really important is that it is a water soluble vitamin. So it does get excreted. As I said, it's around the absorption issues. Balance is important. Yeah. Yeah, it's a difficult one to generalize, but I would definitely not leave it.
Yeah.
I think that's really important. You need to look at all the aspects of a hematology workup. What is a kidney function like?
Yeah.
So maybe, maybe that's the thing to do is to see it, go to a nutritionist, get an overview.
And see, yeah.
So yeah, you just want to contain it when it's 40. I mean, remember, it's, we always kind of consider the B12s as kind of the what would we call them? The sort of the mothering of all aspects in terms of, your neurology aspects, your blood aspects, it's your brain aspects. It's B12 is not just about the blood. It's that tiredness that's unexplained. It's that, nerviness. And I'm not the hormone expert, but it's no doubt Danny and Adele would say maybe something with that.
No, that's great. Thank you so much, Jackie. And if there's anything anyone else wants to add on to that, then please do before we move on to Vivian. No, you're all good. You're all good. Yeah, lovely. Thank you so much. Okay, let's move on to our last speaker then. So Vivian, thank you so much for being with us as well. Thank you so much for that, Jackie. It was so lovely to hear from you and your perspective as well. So Vivian is here in Seed from our Oxford team, and she is PT, but she also specialises in pelvic floor, which I just think is such an interesting topic, and it's something that is so overlooked. I know that I've had lots of conversations with people in the past, and it affects a hell of a lot of childbearing women. But it's often very rarely assessed and often just left because it's just like, oh yeah, it's just because you've had a baby. Just because I've had a baby. And even us ourselves, I feel like we just go into, well, it's just because I've had babies. And there's very little thought, I think, that goes into the implications of this and later on in life, especially. So I'd love to know a little bit about what you do, Vivian, as well, and how do you support clients with their pelvic floor challenges? And are there any misconceptions as well around kind of pelvic floor challenges and exercise?
Yes, so I'm a personal trainer, specialised in women's health. So 99.9% of my clients are all women. They're either prenatal, postnatal, or perimenopausal, menopausal, any women. And I take them through a full body assessment, understand whether they've got pelvic floor issues. If they have, try and understand what's causing that. Is it that their pelvic floor's tight? Is it that their pelvic floor is weak? Is it through trauma, or is it hormonal as well? And I work with a lot of women's health physios as well, so we cross refer. So I'll refer someone out to a women's health physio. They'll do an internal check, which is really one of the main ways to tell how your pelvic floor is doing. And then they refer back to me. So I'm kind of that middle person between women's health physio and going back full blown to CrossFit, for example. So that bit in between. excuse me. Um, so I get a lot of women who have been fit and active before they've had children or before they got pregnant, and they want to continue that, or they want to return to fitness, but they're scared about what damage could they do to their core because it's changed, and when you're pregnant it changes, and what can they do, what can't they do? They're worried that they're going to do exercises which are going to make their tummies worse, that they're going to wet themselves. And then I get a lot of women who have been through childbirth, had children. Their children are kind of leaving primary school, they're having a little bit more time for themselves, and they come to me and they're like, well, my pelvic floor's always been like this because I've had children. And trying to explain to them that actually it is very common to leak when you laugh or you cough or you jump or you can't go on the trampoline, you can't run, things like that, but it's not normal. We spend how many days, weeks, months teaching our toddlers to go to the toilet and to not wet themselves. When did it become acceptable for women to accept that it's fine for them? And there's lots that women's health physios can do, and there's lots of work that personal trainers can do that are specialized in pelvic floor. There are areas that are out of our scope, but until we speak to the person, we don't actually know, and we outsource. But there's a lot of stuff that women they're scared of doing, things like skipping or going to the gym and lifting weights, which they were doing before, because they're worried they're going to wet themselves. And actually, sometimes it's not that they've got a weak pelvic floor, and it's not that they've got a tight pelvic floor. Sometimes it can just be actually the way they're positioning. So the way that they position their ribs over their hips and putting more force through the pelvic floor. So it's about understanding that and watching how the ladies move, looking at their nutrition, making sure that they're going to the toilet properly, looking at I work with a test-based nutrition company as well, who look at omega-6 to omega-3 balance, which is really key because the omega-6 is so inflammatory, the omega-6s are anti-inflammatory, and having that correct balance and having enough omega-3s really brings down the inflammation, especially with women with pelvic floor dysfunction. Women that have just had babies, it's also really good for perimenopausal women. It's good for everyone, but to have enough of the omega-3s and understand that what level you're at by testing it. So that's something I get a lot of my clients to do, is to test, and then they know where they're at. They know that they're not absorbing all the other nutrients they're taking because their omega-6 and 3 levels are out of balance. So that's another big thing that I work on with my clients to help with pelvic floors, and mums that come to me with the mummy pouch, mummy pooch, mummy tummy.
Yeah.
And I'll have ladies that come to me just after they've given birth, like 6 weeks after, and they're like, I've got this tummy. I'm like, you're 6 weeks postnatal. There's lots of stuff we can do, but you're really, really early. And then I'll get women that have come to me 7, 8 years after having their last child, and we still work with those deep core muscles, and we really kind of get their cores back to strength. We help the pelvic floors and a lot of back pain and things like that.
Yeah. Oh, I love
yeah.
I love that. It's so interesting hearing your perspective as well. It's something that I've been speaking to a lot of people recently as well, because I know that I've actually had I had a chat with another women's health practitioner today, and we were talking about kind of pelvic floor and stuff. And one of the things that she said to me was about how in France, every person who has a baby gets pelvic physio afterwards, whereas over here it is just very much like, okay, brilliant, see you, off you go. And like, your body has been through a hell of a lot of trauma in that moment. So like you say, so these lasting effects that women just go, oh yeah, I suppose, yeah, I wasn't like that before. Like, you just get so used to it. And I think because when you have a baby as well, you're dealing with so many other things that whatever is going on with you just becomes the new norm.
Yeah.
And so I think it's really, like, I think it's so important what you do. And I think that's really, really interesting. Before we finish up, is there any tips that you would give to kind of, for people who are listening, just to take away to do with their pelvic floor?
I would don't be frightened of moving. Do go and see a women's health physio or a specialist, and really think about strengthening your glutes, because they are a big, literally, they're a big supporter of your pelvic floor. And if we can get your glutes working, supporting your pelvic floor, that is one of the biggest things. I've got clients that think their pelvic floor is all right, but it could do with some work. And we don't do Kegels, we don't do specific pelvic floor stuff, but we do strengthen their glutes. And they, 3 months in, they're like, don't really have any problems with my pelvic floor anymore, because they're working muscles that are all connected.
Yeah, that's
Yeah.
amazing. I think there's so many people as well, just like they think about just the core, pelvic floor and core. But I think that's the first time I've heard, like, to really kind of hone in on the glutes as well. So
Hmm.
that's amazing. Oh, thank you so much. Thank you everyone for being with me tonight. I think we've given so much value, and hopefully that lots of people will take so much from this as well. So thank you to everybody for being part of this call. And any questions at all, you can find us on the WellVal website, and yeah, and you can always reach out to any of us to ask any more specific questions as well. So thank you very much, ladies. Thank